you say 382 or 383?
383. I done one, but one left different land last month, so they are 383 now.
Do the chair. Maybe you also add up the number of design for the party.
Maybe I can share after the discussion. I don't have to do.
Then, Chairman, if another one, I think we have a very good machine. We call the template, right? To complete the topic within 2 minutes, and we get copies of what the document is.
Okay. Duncan, we are basing your submission on the last payroll. I hope that's what we're doing. We're basing your submission on the last payroll. So you say 807, those are permanent and pensionable? So earlier on, it was 384, one left. Was he or she paid in the last month? So 383 are on contract. Just 20 149 who are on contract also? Yes. We don't be under any pressure. You told us the number of staff who are working in the health department are 1,642. But you're telling us now 1,641. One. So do we take 1641 or 42? For purposes of your submission. Yes. So 1641. So the breakdown here. So 1641. Now, you can, in your submission, you can also give us that these are the doctors, these are the CEOs, maybe later. These are the nurses, these are the pharmacists, these are the lab technicians of each department. Now, of this, you can do it now. Are you able to do it now? Okay, you can do photocopies for you. Now, of this 1641, how are their salaries processed?
The salary process like any other permanent and contract staff.
Are they all paid through IPPT?
We have 35 staff for the whole council who are not in NPPT.
We want you to make your submissions very clearly correct. Give us the number of the staff who are paid through the normal payroll of IPPT and the number of staff who are paid manually.
Yeah, 4,008 staff who are paid in IPPT.
For purpose of this discussion, those in health department.
Give you the exact figure, but they are less than 10 who are outside IPPT.
We don't want to estimate, because we want to be very clear so that we make the right report.
And present the document to the, allow me to present the document to the clerk.
Let me open the.
Thank you, Chair. let me also take this opportunity to welcome that time. And I want to thank him. Even though he got invitation through a phone call less than an hour ago, he managed to appear before our committee. As the Honorable Chair put it, this is a kind of interactive session because of the challenges that we are facing at the health department. That is the reason why this committee was constituted by the Speaker. So I want to thank you because you received information less than 30 minutes ago and you managed to appear for us. That shows respect that you have with the County Assembly. The clerk to the committee has also confirmed that he invited you, but of course through your bosses who is to the Department of PSM. We will handle that later why you never got the information through your boss. Mine is what is the you say that you were working under the current CEP in charge of finance. You are working as what? Under who? As who? Deputy what?
I was working as an accountant.
So you are an accountant. Okay, so working under Lenny as an accountant. Could you tell me who was the deputy payroll manager to Lenny? Where you now? So you went to the finance department, that you are promoted. Number two, what is the reason why the 35 staff under me, the 35 staff, say 10, not more than 10 under one department? What is the reason why they are not under IPPP?
Thank you. Okay, you see, one of the challenges we're having integrating those staff into IPPT is that initially they work under different ministries. So their payroll was managed by different ministries. Like this is the data, they want that the PSC. You find their records are shared by somebody else. So they have to go and clear with the PSC so that their payroll can be created and sent back to us so that we can integrate from our end. Secondly, we have staff who are sharing birth certificates. Whenever we initiate the process of requesting for payroll number, at the DPSM level, their documents are shared by somebody who has been already allocated payroll number. So they have to travel to DPSM.
Chairman,
Yes.
can you tell us and be clear what do you mean by someone sharing?
Honorable Matthew, just a minute, the real is clear.
Yes.
Then I'll give you an opportunity.
Oh, that's okay. What do you mean
I rejoined.
by someone? I rejoined. What do you mean by someone sharing a partner?
Thank you, Honorable. Maybe I can. For example, you see birth certificates are issued at different places. I can give you an example. There was somebody by the name Alice who was sharing ID with somebody from Kisumu, and I provide a copy of the same. The lady had to travel to Kisumu because the PSC identified the person who was sharing the same ID. Then she had to be allocated another ID with a different credential. I'll share the same for your reference. Commonly you have error because it is a typing error when it comes to birth certificate. Somebody who is issuing birth certificate registration office. Sometimes error occurs, a typing error or a digit has been omitted. Then you find the same digit goes less than the normal digits is omitted. It becomes a duplicate record. It cannot allow the system to generate a payroll number. By
So when that happens,
Yes.
how do you pay?
That is why I'm telling you, we should have manual payroll. Those the 35 staff we are paying outside IBPP using the Excel.
Yes. Honorable Moses Roti.
For how long this been happening? Is it since you came in, or this is an inherited problem you found in the system?
Okay, this is a problem that is cutting across, not in Kericho only. The problem has occurred across the country. In fact, we had invited the DPSM staff to assist us to correcting those errors. But also they had the same challenges because the issue cut across, not only Kericho. So it is a system issue that is occurring. Even you have the staff or the intern staff who were recruited recently, they have the same problem. I have more than 20 staff and interns who are currently having the same challenge.
Through the chair, let me ask you a question. Sometimes, how many staffs do you do monthly?
35.
In different departments or helping?
No, different departments.
They have issues, problems, the way you have said, maybe some of duplicate certificates and others have
Okay, you see, the main problem is duplication of records. When a document is keyed in the system and it appears to be a duplicate record, the system can generate the records. Others have problems because they never cleared in the ministry where they worked before. So when they find new faces in the ministry, their file had already been closed. To retrieve those files like health workers, to retrieve their file is usually a challenge.
how long have you been doing
I think the highest number is the interns. But since 2013, they have been
So Duncan,
manual payroll.
for purposes so that we are within the terms of reference for this committee, can you tell us the number of health workers who are paid outside the IPP?
But I share them. You see,
So you do not have the exact number, but you can share
but
with
they are less than 10.
less than 10.
They are less than 10.
Okay. So the issues cut across. You've cited one as they share IDs. That is one reason. Any other reason? Shared ID,
Shared ID, shared birth certificate,
shared birth certificate.
challenging the activation of already allocated payroll number.
So what have you done as a department to address this serious issue? Have you written to these officers?
Yes. In fact, since January, we had withheld their net salary to allow them to fast track the processing of their payroll number.
Are you sure?
Yes.
Have you seen the Control of Budget's report?
No. But I was advised by the COP, Marimbo,
To withhold their salary?
to withhold their salary so that they can fast track their process.
Okay.
Yeah.
Remember?
When
Honorable
such,
Moses Roti.
when such activity happens that involves withdrawal of pay of a worker, it must have a written communication there so that someone's rights are not punched. Do you have any of those efforts?
No.
Thank you so much.
So thank you. So you do not have any written communication from your end to the officers?
Okay, Chairman, I'm very keen on the documents applied with us when we were in Kapkatet. Chairman, we managed to interact with a number of staff who are under FIF. One was the customer care, but you have not indicated in your document that we have staff under customer care who are employed in 2023, but Also, you have not given us the list of staff working under LP who are employed in 2023.
23, we don't have a staff who are employed in 2023.
Okay, I think we'll confirm from the next Chama.
Or rather, okay. Do you have in the Department of Health staff who are working in the customer care department, or those who are in the customer care department belongs to another department, not health?
You see, you don't have, even in IPPD, you don't have such designation like customer care in IPPD. So unless they were given another designation, and then they were deployed as customer care.
Thank you, thank you. Any other member with a question? Honorable Jerry Albert.
He said that they don't have a designation of customer care, but you indicated in your submission we have 4 customer care who are employed in 2018 under contract. Number 16 is customer care. There are 4 of them employed in 2018. Why did you then have to indicate that these are customer care if they are not, if there is no such designation? Then number 2, so that you answer all, give us the wage bill. What is the percentage of the wage bill as it is in our county today? Number 3, your qualification. We will also want to get your qualification so that we, I think those are the 3 questions that I need clarification from your end. Are you a CPA finalist, CPA by what? Thank you.
Yes, Duncan.
Yes,
The technical team, you're failing us. The sound is not very clear.
More staff so that we will know on how we can plan for future as the county. And another question, I think you will answer both with what Honorable Cheriatet has just raised, is that were you seconded to HR? Because one is that who promoted you? Is it the county secretary or the finance department? Because if we had a deputy to head of payroll, I think the deputy could have taken up the position. Since that we had the deputy who has experience in the department, we want to know, the way Cheriatet have just raised, what are your qualifications? And what are one qualification for one to become a head of payroll?
Maybe better still, on the same issue that I had forgotten, your posting letter, your appointment as the head of payroll. Were you given an appointment letter to head payroll? And if yes, is it under acting capacity or what? So if we can get maybe a copy also of your appointment letter, it will assist us. Thank you.
Maybe I can answer that one. I'm acting on acting capacity. No.
Your qualification, Duncan?
I'm a degree holder, CPA finalist,
Degree in what?
business management accounting option.
Can you relate your qualifications with your department or your position?
Yes.
Thank you.
I wanted you to explain for us how much you pay to these maybe nurses who are in contract. Are you in a position to explain for us in every department? Contract.
Allow me, Chairman, to
Yes, just take your time. You can even elaborate further and say those with diplomas, we pay them this. Those with certificate, those who are employed in 2018 are paid this. Those who are employed on contract on 2019 are paid this much. And you can also give us a breakdown of those who you're paying manually.
Chair. Now, their salary varies from based on their qualification. Those on degree holders, we pay them 56,720.
Those are the ones on contract.
Yes,
So 56
720.
for those who are employed 2018,
No,
2019.
across their salaries are in harmonized across.
Harmonized across. Good. Diploma.
Diploma 37,170.
170.
Certificate holder 33,160. Non-medical staff, those are only for medical staff.
Non-medical.
Non-medical staff, for degree holder, we pay them for the 2,370 degree.
42.
For the 2,370. Diploma holder 36,700.
30.
36,700.
700.
Certificate holders, we pay them 31,160. Support staff, we pay them 20,601.
Those are the ones like those who are pushing the.
Cleaners, stage bearers,
How much?
20,601.
So, if we did a random check, these are the salaries across
Yes.
for someone who's working in Kipkelian, in Bureti, in Sigawet, in Ainamo, in Belgut, or any other facility, any health facility.
Yes. That is the two position.
Any allowance? Risk allowance?
No.
No allowance.
I think this was factored in only basic house and commuter. That is why we went for confirmation. What we are looking for only confirmation was only those other allowances apart from basic house and commuter and their pension.
Are you still deducting the house allowance?
Yes, we are deducting.
Even after the High Court ruling?
You see, the High Court ruling came after we had closed our payroll. So we are expecting an update for the same on March payroll.
So where do you get an advisory on the same?
Directorate of Public Service Management. Nairobi.
Okay.
Okay.
Let me give it to
the
Honorable.
personnel whom you are paying manually.
Pardon?
The personnel whom you said you are paying
Yes.
manually.
Pardon?
Tell us how much do you pay for the personnel who had issues? The one you said you are paying.
The salary are like the one I shared.
Honorable Moses, Honorable Matthew, let me give it to Honorable Amos Birir, then Honorable Matthew.
Through the chair.
Then Honorable Dr. Naman, then Honorable Gladys.
Through the chair, there is a question I want to ask Wanatanga. And is this 20,000 the least one?
Yes, for the support staff.
The least one?
Yes.
There is an error which I was supposed to be corrected because this you at first you say customer care is not there. Eventually we found that there is 4 staff working customer cares, or you are not paying these people because that is why you are not aware.
Thank you, Honorable Amos. What happened when I was compiling the list? You see, I was given only 30 minutes. They are supposed to be support staff.
Thank you, Honorable Amos. Honorable Matthew.
Thank you. I want to know if today we decide to confirm medics and non-medics, especially from 2018. I'm asking if you are paying them 56,720, what will be the adjustment for one with a degree?
You see, their salary differs. You see, you can compare salary for a degree holder, for a medical doctor, with an accountant. Their salary
No.
varies because the other one has allowance. This other one doesn't have
I'm
allowance.
asking for one that you are paying 56
Yes.
for medical doctor. I'm asking what will be the adjustment?
Like a medical doctor, you expect them to pay more than 213,680 at the moment.
Okay, for the accountant with CPA, okay? Finally.
More than 70,000.
Okay, thank you.
Thank
To
you.
the
Thank
Honorable
you.
Dr. Naaman Kipsigei-Rob.
Thank you, Chairman. My question relates about staff turnover. I would like maybe you give us a comparative report on the current staff that we have and maybe those that have left the system. And particularly it would come towards the motivation of these staff. Staff turnover, what percentage can you gauge towards there? And then there was a budget that had been put for the financial year 23-24 for confirmation of staff. And then the plan, I understand, is shelved. What is your opinion towards that? Yet it had been budgeted for. Thank you, Chairman.
Maybe I can start with that one. My problem, Nama. The amount that was budgeted was under budgeted. My own opinion was that
We need to hear you well. You're telling this committee that the amount that was appropriated by this assembly in this year's budget was underwhelming, was not as much as you expected.
Yes.
Okay. I proceed.
Now, my own opinion was that why can we confirm the staff who were employed in 2018 and 2020? The amount can be enough to confirm them. Then if the committee can appropriate for 2021, 2022, and FI, then it will be okay. The next budget.
Okay. Thank you, Chairman.
Maybe through the chair.
Is it a rejoinder or a question?
A rejoinder on the
A
same
rejoinder.
chair.
That's a rejoinder then. So, okay.
I would wish that if you could give us what it means by an under budget, maybe from your desk where you sit, what was the amount that was appropriated for confirmation?
It was around 200 million. Yeah,
Around, where did you get this figure of 200 million?
I wish I could have received the communication. I could come with the exact figure. So I don't have the exact figure now.
But you see, when you tell this committee that it was an under budget, then you must be sure of some figures. Because this assembly is aware of a budget of 222 million that was appropriated. Where did you get your 200 million?
That is why I used the word around 200.
In furtherance of the same chair, that is a figure that originated from executive. There were no scaling down in any case because we needed a full transition of these people from contract upwards to PNP so that at the end of the day, we get a motivation, we get service and quality health care to our people.
Okay. Maybe I can
Do you have a rejoinder, Jeria? Then do you want to answer or then you can answer both? All right.
Another rejoinder also. You are the head of payroll, isn't it? Do these people console you when they are making proposals to the budget committee, especially on the exact amount of money that is needed for staffs to be confirmed? Do they consult your office? Because we are seeing different figures here, then you are talking different figures. Do you sometimes sit down and advise them? Now that you are the man in charge of payroll, you know almost everything. Do they consult you, or do you consult them? Whichever come first.
Thank you, Chair. Let me answer the one. Yes, you see, we had a sitting with the Department of Health concerning confirmation of health workers, and they proposed additional 392 for appropriation to be appropriated for the confirmation of the health workers. But they had the opinion that why can we confirm only 2018 and 2020. That is why they came up with the figure of 222. Thank you.
222 million was enough to confirm from 2018 to 2020.
I think so.
No, there is no thinking here, because
yes.
you know you are the man in charge of payroll.
Yes.
So you say the 222 million, if you get the 222 million, you were supposed to have confirmed 2018, 2022.
Yes.
Then what happened? Because we provided this money.
You see, there was, along the way, there was an introduction of housing levy. There was also a review of NSSF. And also there was also a review on salary for civil servant. So even if we can confirm using the 222, we still require some amount to gather for the same.
Through the chair, Bwana Duncan,
Yes.
there is a
Is
question.
it another question, Honorable or the same?
Yes, no. When that amount was allocated for confirmation, there was, is there any negotiations that amount to be shared with the other work? Because it was, that money was sent for confirmation of those who have not been confirmed. But you say now there is a division. Is it what? There was payment of what? Maybe
So,
can you just
thank
check,
you.
because it was allocated for confirmation, that amount cannot be divided to another work.
Thank you, Honorable Amos Spirit. Yes, proceed.
Okay, let me answer, Chair, Honorable Amos. The amount is still in our budget. The 222 is still in our budget. I think it's only advisory for the board to confirm the 2018, 2019.
But you see, we
2018,
made that provision for a financial year. We are beyond half the financial year. So do you still need the whole amount of 222 to confirm, or what figures are you looking at?
No.
So that should in the next supplementary we consider, and if this assembly will consider the amount that this assembly thinks will allow you to confirm those who are on contract, will you, though you're not the one to answer that, but if you make that provision, will that allow us to confirm those who are on contract?
Adam?
I'm saying the 222 million was for a whole financial year. We are beyond half the financial year, because we are already in March. Today is March. 3 months to the close of financial year. So we begin a process, that means a whole month will go. So we only have we only have a remainder of 2 months. So how much budget as the head of payroll do you need to confirm those who are on contract?
What's available, the amount 222 is enough to confirm them. As long as the county assembly will promise that in the next financial year you will appropriate amount more than 392, the one we had requested initially.
But you see, 222 million was for the whole year.
Yes.
Now, in this financial year, we are remaining with 3 months. Today is 1st of March. So if we were to begin the process of confirming, which there is a procedure by the Department of Public Service Board, how much money or how much allocation do you need as the head of payroll to confirm these officers who are on contract? You don't have to answer right now. You can go and calculate, and probably you can do, as you do the other submissions, you can include that. So Honorable Gladys.
Okay, thank you, Chair. From your records, you say that you have a total of 1640. Initially, you had 1642. One left. Don't you feel that there's a vacuum of the worker who left to Finland, or you've already replaced? Or what are the plans that you have to replace him or her? Because when one exits, there should be someone to replace.
Thank you, Chair. Okay, you see what happened when an staff exits a facility. It is upon the department to request for replacement depending on the service needed. Some of the department have more staff and they don't require. Others are understaffed. That is why you find some of the department in some occasion they request for.
Can you cite the departments that you think are overstaffed for purposes of this meeting?
Understaffed nurses.
You talked of overstaffed.
Understaffed. And
So-
we have
No, in your submission, you've told us that there are departments that are overstaffed. Are there any departments that are overstaffed?
no, not at the moment.
Proceed.
So it depends on the service needed by the department and section. And let me put it to be section, departmental section. Like if a nurse exits and when she was working in a facility where they have only 2 staff, they have to request for a replacement immediately. Yeah. Thank you.
Are you able to maybe share with this committee, like in the last 3 months, how many of your staff in the health department have retired? Staff turnover, you will give us.
I will.
All right. Okay. Honorable Edna.
Okay, I want you to explain for us the sum total salaries that you pay for the last 3 months in health department only. Secondly, I also want you to calculate for us out of this 42% wage bill, what percentage to health department covers out of the 42% wage bill? What percentage do health department covers?
So thank you very much. Now, if a doctor is on study leave, are they entitled to a full salary, half salary, no salary, or how do you treat them?
Okay, thank you, Chair. Doctors on study leave are usually bonded and they are paid full salary. When they are on leave, holiday, they usually appear to work, so they are paid full salary.
So if they are on study leave, they are also paid full salary?
Yes,
How about the clinical officers?
they are all the same.
They are all the same.
Yes, as long as they are bonded.
Okay. What do you mean by bonded?
Okay. There are some charges that they pay for the same.
Who determines those charges or fees? Who do they pay? Do they pay the county?
Yes, they pay.
So the county treats that payment as a revenue?
No,
The county treats that
they
what?
are paid to the NITA, National Industrial Training Authority.
Or they are paid to National Industrial Training Authority. Okay.
Through the chair, I have a question to ask. And to this confirmation, I was told by some other staff that we have some nurses who have worked for 15 years and they are not yet confirmed. Is it true?
It's true.
So there are people who have worked in the county government for the last 15 years.
Yes.
And they have not yet been confirmed. And yet what you are giving us here is from 2018. Why didn't you include those that are under contract since time immemorial?
Thank you, Chair. Maybe I can answer. Can you look into the one, the sheet I share? FIF. Those are the staff who worked initially before devolution came in place, and they fall under that car. They were under facility by that time. They were employed by facility, paid by facility. But when county government came in place, they were paid under.
So the 200, in short, the 205 staff,
yes,
have been in county from 20 even
before.
15
Others
years
worked
then.
even before I was employed.
Huh.
Yes.
And they are still in our facility.
Yes, there was one whom we reactivated payroll number. She has less than 6 years to exit service.
So, and the money that you are saying, if you get 392 million, you will confirm all these people, including those under FIF?
Everybody.
Okay. But simple mathematics, Duncan.
Yes.
The amount that you requested was 392 million for the entire 12 months, isn't it? You say if you get 392 million, you will confirm all these people under contract, under health. We are now March, you know. In fact, by 31st of December, you only needed half of this money to confirm all of them. We are beyond even the half. We are only remaining with only 3 months. So the money that is under your disposal is even more than enough to employ all of them under permanent and pensionable. Isn't it true? Yeah.
So there was a question that was asked by Honorable Edna. You've not answered. The percentage.
I'll submit.
Or you'll submit in writing. Okay. I have a question for you. In the Auditor General's report, it's one of the observations and recommendation is that use of manual payroll, personnel emoluments amounting to Kenya shillings 49.90 million were processed through the manual payroll, accounting for 8.7% of the total payroll cost. The manual payroll is prone to abuse, note that, and may lead to the loss of public funds where there is lack of proper controls. In the Auditor General's recommendation, the government requires that salaries be processed through the IPPD system, and the county is advised to fast-track the acquisition of unified personnel numbers for the staff. The County Public Service Board should regulate staff engagements on contract and casual workers as provided under Section 74 of the County Government Act 2012. Further, there should be strict compliance with the approved staff establishment. You heard from the Auditor General's or the Controller of Budget report. Now, my question, what is the total amount that you've been processing through the manual payroll? A month?
Okay, Chair, thank you, Chair. On March payroll, I requested around 1.4 million on manual payroll.
March payroll.
March payroll. And
What?
I'll submit the list of those whom I requested for. with
So
my
how many days do you need to be able to submit?
I can
all
submit it today in the afternoon.
Today in the afternoon?
Even
Clerk,
I can request before I exit, I can somebody to print.
I
the
note
list.
all that. So what are you telling this committee? You told us you've written to those who have not been able to provide documents to be able to comply. with the requirements so that their salaries are processed through the IPPD. So how much or how many months have you been able to withhold their salaries?
We started only on January.
So you've withheld for January and February.
Yes. But we pay at the statutory. Because once they comply, we release the net salary.
Now, these same people who you've withheld their salaries, how do you expect them to perform their duties?
Okay, I think, Chair, thank you, Chair. One, most of them came because it was out of their ignorance. Most of them have come and they are now processing their payroll numbers.
Maybe, Chair, in
Yes,
furtherance,
Honorable Moses.
in furtherance of the same, and also on record that Duncan had told us initially that there is no official written communication to these people of that effect that they are not getting their pay. Now that the process started back in January, and we are headed to a month of March, Duncan kindly elaborate on the same, and also going forward, what does the future hold for these people, and also as the head of payroll, what is the standard and the normal practice, putting emphasis on the HR policy and also labor-related laws on the same.
Thank you. Maybe I can, okay, for our case, we had to process. Other counties have stopped their salary. But we were seeing on your main crown, why do our staff serve, yet we never pay them their NHIF, those statutory. The only precaution we took was to withhold their salary so that when one comply, we release their salary. And this is not the first instance. Other counties stop their salary completely. For our case, we only withheld their net salary. And in most occasions, if somebody comply from Monday to Friday, we shall release their salary by Friday. Because their salary is within our disposal.
Maybe maybe when we finish this session, through the chair, we would want to be given, you'll serve us an advisory on HR when such issues comes up and how they are manned or they are managed conclusively to the end. Thank you.
So, much as we would want to appreciate the humane part of it, we are also aware that ignorance has got no defense, and we all must follow the law and comply. There have been issues around all this. That is why this committee was formed. So should this committee think that you will need more information, we'll still invite you. So thank you very much. I think, okay. Yes, here.
If we are at 42% and we are supposed to be at 35% as recommended, that means there are departments that are overstaffed. Which departments are these? And then secondly, what is your overall advisory on this issue of 42% vis-a-vis the standard 35%? Because you are the people who are advising the executive on the payroll percentage. How do we cure this?
Thank you, Chair. I think the only way we can overcome this issue of wage bill is we put up more revenue stream so that the county can generate more revenue to up the issue of this issue of wage bill. Secondly, is those staff under revenue department can be more motivated than they are now. Thank you.
So thank you very much. Final, we want you to get the latest report from the control of budget. Go through the report, do your part as the head of payroll. The advisory and the observations are very clear, especially on processing payment for staff through the IPPD and the manual one. Please comply. So should this committee think we will need you, we'll still not hesitate to invite you. But we appreciate and thank you for appearing or appearing before this committee, though on short notice, because you had not gotten the formal invitation from the other side. But this assembly did their part. So thank you very much. Wish you the best. Thank you.